Hi, this is Janine Forsberg, and I am presenting a compare and contrast of two models of healthcare delivery. Where we are today. According to CMS, the United States spent $10,348 per person in 2016 for healthcare, more than any other industrialized country. Services in the U.S. are generally for profit. This means that providers are reimbursed for unnecessary tests. Our system focuses on process measures, and quality has suffered from this system. Millions of Americans do not have health care coverage and or access to health care. Compared to Canada, who only spends $5,782 per person, it's government funded and it's free to all citizens. The Canadian healthcare system focuses on outcomes, and quality has improved with this system. Many other countries have been much more successful with different models of healthcare. The major challenges and need for redesign. Our healthcare system is providing too many unnecessary services. Our healthcare system is not good at preventing harm. Our healthcare system wastes too much money and it rewards providers for unnecessary services. It's not transparent to our patients. It doesn't give them enough information to make informed decisions. Overall, our healthcare system spends too much money and has poor patient outcomes. Some may say our healthcare delivery system has been built on greed. It's time to destroy our current healthcare delivery system and create a fair and just system that contains cost, provides high quality, and guarantees access. So what do? The PPACA of 2010 helped increase the availability of healthcare coverage by lowering costs, provided subsidies and incentives to keep costs low, and expand Medicaid coverage. This was a start, but 8 years later, the PPACA still has not met the needs of all Americans, and we have millions of people without healthcare coverage. As nurse leaders, we have to lead change in our healthcare delivery system so it's more affordable, it's accessible, delivers a high quality of care, and keeps our patients safe. The AONA states that nurse leaders have to be creative and drive innovation to lead change and survivability in our healthcare delivery system. Every nurse needs to strengthen their communication, knowledge, leadership, professionalism, and business skills in preparation for leading change. There's two models that I considered. Aligning with the PPACA, two models that are considered to embrace the four concepts of the nursing paradigm of person, health, nursing, and environment are the PCMH and the ACO. Both the PCMH and the ACO also align with objectives from the PPAC to lower costs, improve quality and safety, deliver patient-centered care, embrace quality improvement process, and have a team-based approach which limits waste and improves access. Both models offer opportunities for the advanced practitioners for expansion of their practice. The PCMH is an organized primary care model. It uses an interdisciplinary team approach. It improves coordination of care where all providers collaborate together with the patient and their family or other significant others to reach the optimum level of health for the patient. The PCMH takes responsibility for providing all the patient's healthcare needs, arranging care with the other qualified professionals. The PCMH primary care physician is actually the gatekeeper for all services for the patient, which prevents repetitive and unnecessary tests. The PCMH is generally found in independent medical practices, a medical home. The ACO links payment and delivery to improve quality and reduce costs for certain populations. This healthcare model it includes physician groups, health systems, insurers, inpatient and outpatient facilities, skilled nursing facilities, and small physician practices. It bears all financial and clinical responsibility of patients and patient populations across providers. It also receives financial incentives for keeping services to a minimum. The ACO is a payment system between groups of medical professionals, and the patient may get lost in this disjointed approach. So, which model would be best for the U.S.? I believe the PCMH keeps care close to the patient. It's individualized and coordinated, so there's less chance of the patient getting lost in the system. The PCMH works to build strong relationships between the care team and the patient. It's transparent and involves the patient in decision making. Research has shown that PCMH improves quality of care, patient and staff satisfaction, while reducing healthcare costs. It also reflects the nursing meta paradigm in that it encompasses the action of the nurse, the person receiving the care, the current health of the person assessed and evaluated, and the plan developed, and the internal, external, environmental influences. So, what about the PCMH in nursing theory? The PCMH actually reflects Gene Watson's theory of caring, focusing on promoting health, preventing illness, caring for the sick, restoring health, and the treatment of disease. It realizes that the practice of caring is central to the heart and soul of nursing, and nurses need both artistic and scientific knowledge to master this science. It's also an interpersonal and truly cares about the well-being of the patient, which promotes trust between patient and providers and improves health outcomes. What about the PCMH and quality of care? It meets the designation of both nursing excellence with both magnet and quality measures set forth by Medicare. The PCMH has been recognized by the NCQA for meeting 6 measures needed for assuring high quality of care: patient-centered access, team-based care, population health management, care coordination and care transitions, and performance management and quality improvement. Inquiry, analysis, and action elements of the PCMH. Close personal relationships between physician and patient and coordination of care meet the elements of inquiry. Group meetings held with the PCMH every day, the team between providers, where strategies are developed, meets the elements of the PCMH. And the action elements are met by coordinating with the community to meet the needs of the patient, the community health advocate for the patient. It mobilizes and educates patients to fight for the common good. There's shared responsibilities between the PCMH and the patient. And the PCMH uses evidence-based medicine to model their quality of care. The PCMH meets the needs of all the elements. So in conclusion, the U.S. healthcare system is broken and has to change, and as nurse leaders, we need to lead the change. The new healthcare delivery system needs to focus on health levels and outcomes, eliminating financial rewards for needless tests and services. Nurse leaders need to create and support a healthcare delivery model that rewards prevention, lowers cost, provides high quality of care and patient safety. In reviewing both the ACO and the PCMH healthcare delivery models, the PCMH was chosen as my ideal model because of its team approach and involving the patient in their care. The PCMH is organized care, usually in a physician's office, is patient-centered. It coordinates care through one primary care physician who may involve a team of other providers who all work together with the patient to help them achieve their optimum health. And the PCMH also, their objectives are to lower costs, improve quality of care and patient safety, limit waste, and improve access for all people. The PCMH embraces the 4 concepts of the nursing paradigm of person, health, nursing, and environment. It reflects Gene Watson's theory of caring, focusing on promoting health, preventing illness, caring for the sick, restoring health, and the treatment of disease. The The AONE is calling all nurse leaders to drive change in our healthcare delivery system. No longer can we afford to sit back and wait for things to happen. It also encourages all nurse leaders to be skilled in communication, knowledge, leadership, professionalism, and business. And nurse leaders need to use their skills to create more efficient and safer healthcare delivery models. Our country deserves a high quality, low cost, efficient, coordinated team based approach such as the PCMH healthcare delivery model. Thank you.